silent thief of sight. It's a disease where the pressures of the eyeball build up gradually and causing damage to the optic nerve progressively. Normally, like how everyone has a blood pressure, similarly there is a pressure for the eyeball. It is called intraocular pressure. So this pressure is normally created by a fluid secreted inside the eyeball, which is drained out through a filtering channel. For some people, with unknown reasons, the filtering channel at a particular age stops working or kind of works dysfunctionally, or sometimes as well gets totally blocked, thus building up the intraocular pressures of the eyeball, which indirectly puts pressure or damage to the optic nerve, and this is called glaucoma. This is a progressive disease, but unfortunately throughout the disease the person who is having glaucoma never comes to know or will never have a sign or symptom of glaucoma in his eye. Certain risk factors which lead to development of glaucoma, of which the family history being the highest risk factor. Somebody in the family having glaucoma, like elders, blood relation, then the patient tends to develop glaucoma more faster at a very young age. Other risk factors being myopia, steroid usage, anybody over 40 years of age, previous eyeball injury and all. Diagnosis of glaucoma includes mainly careful clinical examination, wherein the intraocular pressures are measured by the applanation tonometry. The optic nerve is examined by 78D or 90D lenses, and pachymetry is done to measure the thickness of the cornea. The RNFL, that is the retinal nerve fiber layer thickness, is measured by the OCT, and the visual fields of the patient are assessed by the Humphrey Field Analyzer. These are the various investigation modalities used to diagnose glaucoma. Once the diagnosis of glaucoma is established, the management basically lies either in the form of a medical management or surgical management, depending upon the staging of the disease. Medical management of the glaucoma includes prescription of various types of anti-glaucoma drops, that is, drops which could reduce the pressures of the eyeball. These include certain medications such as prostaglandins, beta blockers, alpha agonists, and various other types of medications. Once the medication is prescribed and the pressures reduce, then the disease stops progressing, and this progression or non-progression of the disease is basically mainly followed up by repeated field examinations, which are done sometimes annually or sometimes biannually also. In spite of putting the medication, if the disease tends to progress, then the decision to operate is taken. So surgical options of glaucoma include basically in the form of trabeculectomy, where there is an opening created manually for the fluid to drain out. Other options where the trabeculectomy tends to fail are implanting Ahmed glaucoma valves, or some type of implants are also implanted. Bangalore Nethralaya, diagnosis of glaucoma happens by initially a refractionist does a basic examination followed by an intraocular pressure screening. Intraocular pressure screening is done by non-contact tonometer as well as eye care tonometer, and then this is followed by an expert examination with a glaucoma specialist. Once the glaucoma specialist sees the patient and diagnoses to have a glaucoma clinically, further it is being confirmed by some investigation modalities in the form of HFA or OCT. And the surgeons or consultants at Bangalore Nethralaya are well trained to diagnose and treat any type of glaucoma, be it in the form of primary glaucomas or secondary glaucomas as well.